Good evening, everyone. It's 6 o'clock. We are going to get started with our Project 813 online town hall meeting. We want to thank you for taking time out of your evening to join the Crowley ISD team tonight, and also an expert panel that we've been working with throughout the entire COVID-19 pandemic, and is providing us some valuable information as we prepare for a safe return to school on August 13th. There's a lot of information out there, and so what we wanted to do was get these experts together for our community to hear from, allow you the opportunity to ask questions, and we'll talk about how that's going to work tonight. But again, we just want to thank you for being here. We have right now over 155 people watching us here in Zoom, but we're also streaming this town hall meeting on Facebook as well. And so if you're joining us from Facebook, welcome. And we will get started with our next slide, please. Tonight, we are going to hear from a distinguished panel of experts, both in the field of education, but also the medical field as well. Dr. Crystal Taylor with Goodson's Education Global Consultant. She is teaching in China right now and has been on the front lines of the pandemic and responding there. When we have medical experts here from across Tarrant County, John Sims, Dr. Diana Cervantes, Dr. Leslie Alsop, and Dr. Kenton Murthy. And this evening, you'll get an opportunity to hear from each of them and ask their questions. And tonight, let me show you how we're going to be able to ask questions during this webinar. Along the bottom of your screen, if you're joining us in Zoom, you should see an icon that says Q&A. You can click on that box and type your questions there. If you're watching us on Facebook, we ask that you would put your questions or comments there in the comments section on Facebook. We will not have the opportunity to answer every question we receive tonight. And we also know that we don't know the answer to every question just yet. But what we're going to do is we're going to record all of these questions and comments and take them back to our team and use that as we prepare for a safe return to school. So we want to thank you in advance for providing your input and your feedback, because it's only going to help us to do better and to do right by kids as we prepare for the safe return to school. Dr. McFarland, tell us what that looks like and how that aligns with our Vision 2025 here in Crowley ISD.
Well, thank you, Mr. Kirshner, and also thank you to our parents and community members who have, first of all, been patient with us as we have adjusted to this new reality. What I want to assure you is that we are taking every precaution necessary. We're looking at everything that we possibly can review to kind of determine the best way forward. One thing that I can tell you is that during a crisis and in times like these, it is so important to have like guiding documents that actually ground the organization. And for our organization, our guiding document is really our Vision 2025. And so when everything else around us is changing, what we know will stay the same is our Vision 2025 strategic plan, which was a document that was created from our community and from collaboration with our community. What the community told us, what you all told us was, number one, you wanted to make sure that we have systems and programs and practices in place so that we have thriving students. We wanted the students to leave us via graduation with more than a diploma. In order for them to do that, we know that we must give them engaging experience that will help them to thrive in society. We also know that goal 2, it was clear, from the community members who participated in our strategic plan, that we wanted to have a community that's really engaged and really involved in understanding the decision making of the district, really aware of kind of what we're doing, what we're thinking, how we're thinking about the issues that are facing us. And so one of the reasons why we're having this town hall tonight, quite frankly, is that we heard you loud and clear, community, when you said you wanted to be informed, you want to be engaged, and we're listening. And so goal 2 really talks about our desire as a community to be engaged in the process. Tonight is your opportunity to do that. We're going to bring experts before you, and you'll have an opportunity to ask questions, to continue to help us to kind of think through where we go from here. And we know that it's important for us to get your feedback, and so we need it. And then goal 3, of course, is an empowered staff. Here's the reality. If our students are not thriving and our community is not engaged, then the staff will not be empowered to do the things we need. We believe that these 3 things connect. These are 3 major goals for us. And this town hall meeting is really the first of many that we believe will help us to make better decisions. And so our goal 3 deals with having an empowered staff. a staff that has the knowledge, the ability, and the belief that they can make a difference, and we're prepared to do that. Again, our Vision 2025 is clear for Crowley ISD. We want to be the top performing district in Tarrant County. We believe we can get there, but we believe the only way we get there is through collaboration and input from you. Tonight, that's what that's about. That's what this is about tonight, is to get information from you about what you feel would be most important as we begin to think about returning to school. Again, thank you all. Thank you, Mr. Kirshner. Thank you to the panelists, and we're just looking forward to a really robust conversation tonight.
Thank you, Dr. McFarland. We have several members of our CISD Board of Trustees who are joining us this evening to listen to your questions and concerns. And so we want to thank our trustees for their leadership and their vision for making this happen. And so we're already getting some questions coming in. And just a reminder, please continue typing those questions either in the Q&A box on Zoom or in the Facebook comments section. And we may not be able to answer all those immediately, but we will be filing all those questions and using those as we prepare. Our first expert panelist this evening is joining us all the way from the other side of the world. Dr. Crystal Taylor has been providing valuable information to our board and our district leaders about what's happening on the front lines of COVID-19. As you all know, China was kind of ground zero. It's a couple months ahead of Texas, the United States, with the COVID-19 pandemic. And Dr. Taylor is an educator from the United States, has roots here in Texas, but she is now an educator in China. So I'm gonna let Dr. Taylor introduce herself, and please, let's give her a warm Crowley ISD welcome from Crowley to China. Dr. Taylor.
Thank you so much, Anthony. I am honored to be here on this expert panel. Just as Mr. Kirshner said, I am an American educator who I am now leading an English department here in China. I'm about 7 hours away from the epicenter, which was Wuhan here in China. I work at an international boarding school, so we have students coming from all over to our school to be educated. So we understand the struggles right now and the challenges that you may have as you're considering restarting school. So I'm going to go ahead and get started with this presentation, and I will answer any questions that you may have. So just a little bit, I've already told you I'm about 7 hours away, 7-hour drive away from Wuhan. One thing that is important to understand, we started to reopen school when we had completely flattened the curve. We were on a quarantine for about 2 months. You saw mask temperature checks were being taken and monitored daily, even while we were at home. When we started to open back schools, we started with ensuring that our staff was trained. And then we went to students and parents. And so this training basically provided you with information on COVID-19 itself, but it also, wanted to provide you with a sense of comfort that we are doing the best that we can to ensure that when your students do return, they are returning to a safe environment. We also wanted the environment to be one that, although it may look different, with the wearing of the mask, which we didn't do prior, that we still wanted to create a culture that the kids enjoyed being at. And so that was very important for us as a leadership team at our particular school. Schools reopened with temperature checks and testing. That is also important. In order to step foot on our campus, all of our kids, staff, they had to have their temperatures taken, and we did start off with mandatory masks. Everyone had to wear a mask the entire day throughout school, with the exception of PE. We did not have any extracurricular activities like basketball, the sports that would probably bring crowds in. We are a new school, we're just opening, and so those teams are really not established just yet, but we have decided to hold off on those until we, transition students back into our campus safely. All grade levels did return safely to our school. We returned back in batches. We started off with our seniors, our higher levels. The school that I work at, we're a K through 12 boarding school. So we thought that it would be important for our students who are older, since they will be preparing for exams, to get back into the classroom, get that face-to-face teaching. It took about a month for our a little bit over a month for our entire school to transition back onto campus with face-to-face teaching. Just to give you some hope, I know that this is a trying time for you back in the States. Mine home, I am keeping up daily with what's going on. I want to let you know that it does get better, but you also have to work together with the school and really partner with them to ensuring that you guys are all on the same team. Now we have, their masks are not mandatory, they're optional. So if you come to our school now, you won't see a lot of masks there. But when we started, it was the complete opposite. It's also important to stay vigilant with what's going on around you. So we are aware that new cases have begun to pop up in Beijing via an import-export market. Beijing, they're taking necessary precautions there, but we are also taking precautions here, although Beijing is still pretty far away from us. Because we are an international boarding school, it's important for us to know if our students or parents, if they have family members, spouses that work at Beijing, that they have been visiting. So we have already sent out communication to parents trying to understand who has visited Beijing prior to May 1st. That way we can have an understanding of who we need to probably start to do a little contact tracing on to ensure that nothing breaks out at our particular school.
Dr. Taylor?
Yes.
We have a question from one of our attendees, Gina McNeely, who's just curious, what is the size of your school, the student enrollment?
Yes, we have about 2,000 kids at our school.
Thank you.
I'm ready for the next slide. One thing that we have to remember, priorities during a pandemic, is the health and safety of the staff and the students. And so to ensure that communication is taking place on all sides of that, I know that working with Crowley ISD, they are doing a magnificent job of considering certain procedures that may need to be implemented in order to ensure that when students return, that is, they're returning to a safe campus. That involves training. It involves partnering with your health authorities. That way you can keep up with the latest data, because in the end, data drives the decisions on how you will reopen. So it's extremely important to establish a partnership with health authorities in your community. And also just to maintain contact with your school, your children's school, to ensure that everyone's on the same page, and to remember across the board that to be flexible, because although plans may be put in place based on what is currently happening, those plans may have to be altered. So remember to be flexible as your district is actually communicating these plans. Be open-minded, understanding that at times they may have to veer in a different direction based on the current situation. How can parents help? So not only am I an educator in China, I am also a parent in China. I have a daughter here. She is 5 years old. She is also in kindergarten. So some of my concerns, I'm sure, are some of your concerns, to ensure that your child, your precious cargo, is safe when they're going to school every day. One thing that you can do that I did and that was recommended to our parents here is that we openly converse with our children about what was going on. They had an understanding on their level with what we were dealing with. Remain positive and empathetic. Try to relate to the emotions, for me, of a 5-year-old who's now 6. I had to explain to her about the virus on a 6-year-old level so she could understand how to wear her mask and why it was appropriate to wear her mask and why she shouldn't take off her mask. And when we actually got to a state to where we were no longer wearing masks as much, we would walk out the home and she would say, "Mom, wait, you don't have your mask." You know, so she's 6 and she was reminding me to put on my mask. And so, and we had gotten past that phase. And so it's very important just to openly talk to your child. They will understand if you remain positive and let them know that everything's going to be okay. Teach them how to properly wash their hands. We send out a link to all of our parents with instructing them on, you know, really how they can have these conversations with their kids, how to teach them how to wash their hands. I know that Dr. McFarland got a great video that was fun that you could share with your students, with your children, to you know, just teach them how to wash their hands in a fun way. So watch that video with them and get this dialogue started. Help them understand, when you understand the procedures that the school is about to disseminate, you actually assist them with understanding and set those expectations at home. Make sure that you're modeling, you know, what is actually being said. That way the kids can actually see that, you know, yes, mom's doing this, dad's doing this, I need to do this. And once again, I can't stress the importance of communicating with the schools. If you're sick, stay home. If your child has a temperature, keep your child at home. Communicate with the school health authorities, the school nurse, that your child is sick, has a slight temperature, you're monitoring it. It's very important to maintain that communication. That way you're not just helping yourself, but you're helping others as well. I've talked about just remaining positive, considering the students' emotions. This is basically, as we're returning to school, the pictures that you see up front. And if we can go to the next slide. This bottom picture is where we are now. You can see very little social distancing, no mask. And so the top right is right when we started. The bottom one is where we are now. So this too shall pass. I want to give you hope. You will get back to, you know, this time. It may still look a little different. Our lunch room, the way that we're eating lunch now, it doesn't look the same as it did prior to COVID. But things slowly start to become a little bit of the norm for the kids. This chalkboard that you see in all of our classrooms, this is on their particular chalkboard. It's a reminder that, you know, although we are starting to slightly get back into the norm, we're going to stay vigilant on what is happening around us. We're not going to forget that we're in a global pandemic. And so I want to just let you know, if you follow the recommendations that are being given to you, practice social distancing, wear your mask. You know, those times will eventually pass, but you have to go through that hard part first. But it's worth it. I can tell you, to get to the picture at the bottom, it's worth it. So I do thank you for your time. And I look forward to working with Crowley ISD more.
Dr. Taylor, that is great information, and just hearing your perspective there from China is really, really helpful. We had some great questions in there about specifics about your school that we'll go back and compile answers to. And also, just for all of our attendees, if you're just now joining us, we will be posting a full recorded version of these presentations on our website after this, and be working to answer all of those questions you're submitting. So thank you, Dr. Taylor, from the entire Crowley ISD family. We look forward to continue working with you in the days, weeks, and months ahead. Right now, we have more than 225 people here with us on Zoom and more than 220 or so watching on Facebook. So welcome, everyone. Our next presenter is from the UNT Health Science Center School of Public Health, Dr. Diana Cervantes. We heard what's happening in China. Let's bring it closer to home. Dr. Cervantes is going to share some national, state, and regional trends with us. Dr. Cervantes, thank you for being here.
Thank you so much. Can you hear me?
Yes, we can. Thank you.
Okay, great, great. Well, thank you so much for allowing me to be here and just give you just a brief update of kind of what's going on nationally and trends. And really what I want to cover is some of the things that you hear a lot about on the news. And, you know, I get a lot of questions from people that there's a lot of information out there and what does it really mean? So just going over some general trends, some of the things you're going to hear. And again, this is the information I'm going to show you. It's information that's available, and it's available to the general public. So after this town hall, you can access this information any time to just get the updated information. Also, I just want you to keep in mind that when I talk about cases, I really mean people who test positive. So those are people who do and do not have symptoms. So just to take you through this slide, so there are over 2 million cases of COVID-19 that I'm just going to refer to as coronavirus, just to make it simple for myself as I go through this presentation. And there's been over 115,000 deaths. And of course, not surprisingly, that Texas, with about 90,000 cases and about 2,000 deaths, is in the top 5 states with the most cases. But it's also one of the top 3 most populous states, along with, you know, California and Florida. But if you look at the rate, meaning the number of cases of coronavirus per 100,000 people in the state, Texas is actually one of the lowest ranked at about 300 cases per 100,000 people in the state. Now, that's if you compare it to, for example, like a New York City, where they're reporting about 2,500 cases per 100,000 people in that city. Or even Louisiana, who's reported about 1,000 cases per 100,000 people in the state. So that's just something to keep in mind. Next slide, please. So, so for this next slide, this is just focusing a little bit more on the details of the state. And again, as you saw in the previous slide, we're talking about in Texas about 90,000 cases, coronavirus cases, and about 2,000 deaths that have been reported in Texas as of yesterday. And you could see here in this map, the blue circles just indicate the amount of cases that are being reported in a specific region of Texas. And again, no surprise that the majority of cases are found in the most populous counties. So you could see there on your right, the top 3 counties are the most populous counties, being Harris County, Dallas, and Tarrant counties. You know, so what I really want to highlight here, though, is that there are definitely hotspots and high-risk situations, occupations, and facilities, and those really make up a large proportion of the cases and the deaths in our state. So due to the way that coronavirus is spread, and it's mainly spread through those respiratory droplets, any kind of congregate living situation, so where you have a lot of people that are housed together, and situations in which there's large groups of people that are close together for long periods of time, you know, this poses the greatest risk for people to get the virus. So throughout Texas, those hotspots include correctional facilities, meat packing and processing plants, and nursing homes and assisted living facilities. Now, as you can see here, what I've highlighted is that nursing homes, because of course of that congregated living situation, but also because the people are at so high risk because of their age and because they can have underlying health conditions. So even though they just make up 6% of the cases in Texas, they make up almost half of the deaths in our state. So it's important for people to know that when they're looking at this information that's provided by the state, just keep in mind what the goals are by the state. Okay, so really when you talk about prevention control in the state, like what is the point of putting out all this information and why are we tracking it? Well, in the state, they have 3 primary goals. The first is to protect the healthcare infrastructure. So to make sure that our healthcare isn't overloaded so that if we do get sick, we can go to a hospital, seek healthcare. The second is to make sure that the state is protecting the people who are in vulnerable populations. So as you can see here, with 46% of the deaths being in nursing homes and assisted living, that's one of the priorities. And also the last is to protect critical infrastructures. So those things that we need for our everyday lives, those things like meat processing plants and schools, of course. So that is really the goal when you're looking at this. So the goal is not per se to see a reduction in the number of cases overall with coronavirus, but really just think about those three main goals when you're looking at this information. Next slide, please. Okay, so here in this slide, what I want to just go over some basic distributions in Texas, because I get a lot of questions about this. And first, I want to point out that when you look at this information, just note, you can see on your upper left-hand corner that this information is based on about 15% of the cases. So just keep that in mind. It is definitely incomplete. As you can see here, the majority of cases are in the age groups of 20 to 59 years of age. So they make up about 70% of the cases. And this is pretty similar to what is being seen in the United States, where the median age is about 48. And this could be influenced a lot by, increased testing that's occurring in these hotspots that I mentioned, correctional facilities, meat processing and packing plants. And those for people who are 19 years of age and younger, they only make up about 5% of all of the cases. And the reason for this is likely because those people who are younger may likely have really mild signs and symptoms, or they may not have any signs and symptoms. So they're less likely to go out and get tested and therefore be reported. As you can see here at the very kind of center of the screen with gender, in regards to males and females, we're seeing about slightly more of the cases tend to be males. In the United States, it's about even. Again, this is incomplete data, so I'd say it's pretty even at this point. But in regards to race and ethnicity, that's on the upper right-hand corner, one of the things I want to point out, again, this data is very incomplete, about 85% incomplete. So here, if you look at this, Black and Hispanic populations don't appear to be disproportionately affected by coronavirus. But just note that in the United States and in areas of Texas, such as North Texas, a higher proportion of cases that are being seen are in our Black and Hispanic populations. Next slide, please. All right, so for deaths in Texas due to coronavirus, again, just keep in mind, as you see on the upper left-hand corner, this represents about 30% of deaths in the state. And here you see very similar trends as we saw with the last slide. But again, what I want to highlight here is that unlike coronavirus cases that we saw that the majority were in that 20 to 59 year age group, here the majority of the deaths, about 40% of the deaths have occurred in those 80 years of age and older. All right, next slide, thank you. All right, so the other trend I want to cover has to do with percent positivity, because again, we hear so much about it in the news. What does this mean? So basically, the percent positivity is of the people that have been tested for coronavirus, in what percentage was coronavirus detected? Now, in the United States, there have been over 23 million coronavirus tests that have been conducted, and that's the type of test that looks for the actual virus in the person. And in the United States, of the people who have been tested so far, coronavirus has been detected in about 11% of those people. Now in Texas, that percentage ranges from about 6 to 10%. But what I want to highlight here is that in this map, you could see that it looks like Texas is a darker blue, making it seem like, oh, it has higher percent positivity, but really it's darker blue because as you can see on your right-hand side, that it's really based on the number of tests that are being reported. And Texas is reporting a higher number of tests that are being performed, which is good for our state. And there's no specific goal percent, so being below a certain percent, that is, like a standard. It's just keeping track of a trend. That's what's important. So if you want to go to the next slide, please. So here we see in Texas, what we're seeing in regards to trends with positivity is there is sort of an upward trend that we are seeing. But I think it's important to note that in Texas, when you look at this information that Texas provides that Texas is reporting a percent positivity that isn't per se a true percent positivity. So it's not reporting of the people tested what percentage was coronavirus detected in, but what it's really looking at is of the total tests that were reported on that specific day, how many cases were also reported on that day. So I think it's just something to just make note of, but I think the main point here is that we are trending more upward on our positivity rate. So more people that are being tested, we're actually detecting coronavirus in those people. Next slide, please. All right, so you hear a lot about hospitalization and what, that it's an important measure to kind of keep track of what's going on with coronavirus in our state. So for hospitalization in Texas, the overall trend is increasing here, as you could see. And in the United States, about 14% of cases are hospitalized, about 2% are admitted to an intensive care unit, and about 5% end up dying. And one thing I really want to point out what I really want to point out is the people who are at greatest risk for severe coronavirus outcomes. So in the United States, 1 in 3 cases have reported underlying cardiovascular disease, and that includes hypertension. About 1 in 3 are reporting diabetes, and about 1 in 5 are reporting chronic lung disease, such as asthma or chronic obstructive pulmonary disease. So with hospitalizations in the United States, and we're probably seeing a very similar trend here in Texas, is hospitalizations were 6 times higher and deaths were 12 times higher in those people who reported those underlying conditions. Next slide, please. So in this graph, this is just showing hospitalization trends in our region, meaning the Dallas, Denton, Collin, and Tarrant, our big 4 counties here in the North Texas area. And as you can see with the state, we're also seeing an increased trend in hospitalizations in our region. Okay, next slide. All right, so here lastly, I just want to take you through this graph. I think it just confirms what we already, of course, suspected, that as you can see at the top, there's this gray bar graph. It shows a trend in the change in cases, so it's increasing. And at the bottom, it shows different lines, and what those lines indicate is increased mobility. So are we seeing people out and about more in transit stations and workplaces? So we're seeing that's increasing as well. So as the change in the number of cases increases, we're also, of course, not surprisingly, we're seeing an increase in mobility overall. So that's just, of course, just something to highlight there as well. All right, the last slide. And I just wanted to again, just make sure that you're aware that all of the information that's presented in this slide, in this presentation, it's available through CDC. They have a really good coronavirus data tracker, and the state of Texas has really good information that is open and available to anybody who wants to look at it.
Dr. Cervantes, that's some great information. Thank you for compiling it in a way that's easy to understand and explaining what these numbers really mean. We did have one question for you from Crystal Jordan watching on Zoom. And this is in reference to your slide about the demographics, particularly the age range of people that develop coronavirus. She was asking, do you think that low number of COVID patients being 18 years and younger has to do with most people who are 18 years and younger right now not being in school? They've been isolated.
Right, it's hard to tell. I think though what we're seeing is that even in those kids that we do see cases, their symptoms tend to be very mild in general. So there have been some rare reports of children that have certain types of inflammatory disease, and I'm sure that Dr. Murthy could speak a little bit more about that. but in general, in the cases that we are seeing, that we are detecting, the cases are really, really mild. And it's not unusual for respiratory viruses to see kids where they do tend to have more mild disease. And in adults, you'll see more severe disease, because as you saw from the other slides, the people who have more severe illness are people who report having underlying conditions. And most of those underlying conditions come to us with our age, unfortunately. And so children typically don't have these conditions. And so therefore usually have mild signs and symptoms if they have any. So that, I think, is what we're seeing. Of course, we're just going to have to see what happens when school starts. But I think even in other areas, as you saw in China, the cases, they tend to be very mild in children.
Thank you. That helps a lot. Well, and Dr. Cervantes, we also want to thank you for sharing the source of this information. It's there on your screens again. And I know this information, these numbers are updated daily. And so thank you so much for those resources. So Dr. Cervantes talked about the United States and the state of Texas, but here to talk specifically about what's happening in Tarrant County is Dr. Kenton Murphy. He's Assistant Medical Director for Tarrant County Public Health Department. Dr. Murphy, can you hear us?
Yes, I can. Thank you.
Thank you for joining us, sir. Tell us what's going on in Tarrant County with the numbers this week.
Absolutely. Good evening, everybody. My name is Dr. Murphy. I'm the Assistant Medical Director and Deputy Health Authority here at Tarrant County Public Health. Thank you very much for having me. It's an honor to be here. We're going to be talking about COVID-19 and Tarrant County statistics. Just as a recap to review, remember COVID-19 is the disease that stands for coronavirus disease 2019. It's caused by an RNA virus called SARS-CoV-2, or severe acute respiratory syndrome coronavirus 2. It's a cousin of the SARS virus, which came out in 2003. That's the severe acute respiratory syndrome. That was a pretty powerful disease. Started in 2003, but it had very limited spread. So they're related. The related virus that developed in 2019 that has caused more infection. Has a smaller fatality rate compared to its cousin SARS, but still quite infectious, and that's for a variety of reasons for this virus. Just to recap symptoms, our main symptoms that we started saying when the virus first came out was cough, fever, 100.4 above, shortness of breath. We've since learned a lot about the virus, and we've seen that its symptoms vary a lot in individuals, from elderly to children. But in general, we've expanded the symptoms that generally develop with the COVID-19, and that includes body aches, chills, lack or loss of sense of smell and taste. We've seen pink eye or conjunctivitis. So we've seen a variety of symptoms that have developed in addition to the typical cough, fever, and shortness of breath. So it's a very varied symptomatic disease that we've seen, which part of the reason makes it very difficult to ascertain and detect, especially during cold and flu season. I also want to make a note that the SARS-CoV-2 is from a family of coronaviruses. There are also seasonal coronaviruses that we see every year that are not COVID-19 related, and those coronaviruses cause the common cold. So as we enter the fall season, I know we just started summer, but as fall comes up and we start seeing some of these seasonal respiratory viruses come about, it's going to make it even harder to kind of ascertain what symptoms are with COVID versus just your seasonal corona or cold virus, and even when we see flu. So it's going to be very important as we move on, especially in the fall, to definitely do our continued masking, washing hands, social distancing, getting our flu shots, keeping up to speed on all our vaccinations, because it's going to get harder and harder to start distinguishing between the novel coronavirus or COVID-19 versus the other viruses that we'll have this fall. So let's get straight into it, into our statistics of Tarrant County. Our county follows a lot of the national trends, partly because it's the diversity of our county and how big it is. There are 2.2 million people in our county alone from all various cultures and ethnicities. So these statistics are from our website. So if you haven't been to our website, tarrantcounty.com, you go to www.tarrantcounty.com, you can see this dashboard. You click on COVID-19 dashboard. It'll be right on the front of the page of that. And you can see our statistics. This is from this morning. We update it at midnight every night. So these are the latest statistics that we have from that. And you can click on all these links and you can kind of follow along how our trends are doing here in county. And like I said, they tend to follow the national and state trends due to the diversity of the county. So let's look at what we have today. So as of Monday, we've had 7,498 positive cases. We had 164 new cases on Monday. We've had 197 deaths and about 3,100 recovered. Now, that recovery data is not something we actually track. There's nothing that we really just are having people report that they have recovered. It is something our epidemiology team, and we have a large epidemiology investigation team that will monitor some of these patients that have become positive, and we continue to track and see if they're being recovered. So that's why that number is significantly smaller than the positive cases, because it takes time for our team to call and continually see if those symptoms have resolved. I'll get into in another slide about the cases and deaths and by gender and age group, but if I can focus your attention on the bottom part of that slide, the hospital capacity key metrics. And this is pretty unique to our county where we have some of these metrics. Some of these metrics are hard to find, but essentially what this is showing is that in Tarrant County, we have a total bed capacity of about 5,400 beds. That's 5,000 beds that can actually hold a patient. And currently there's only about 3,600 beds that are occupied. And they could be occupied for various reasons, whether it's coronavirus related or a heart attack, trauma, something like that. But currently there's 3,600 beds that are occupied. And we know that at least 204 of those beds are confirmed COVID-19. But this could be more than that, but we at least know this is how many we currently have in COVID-19. And then we have about 584 ventilators. You know, back in the early stage of the disease, especially in New York City, we saw this huge need for ventilators. Well, compared to New York, we've been very fortunate that we haven't had this giant, enormous explosion of coronavirus. We'd have an incremental increase. And so that's what has allowed us to keep our ventilators open and our hospital beds open as well. The next slide, please. So this also, again, is on our dashboard, but this basically shows our cases by report date and the cumulative cases and deaths. So let's look at the left-hand graph. What you're basically seeing is this, the number of basically cases we have on a daily basis. You also look at it on a weekly basis from April through June. And as you can see, if we could trend this out, it increased. It really started to peak in May and then started to go down a little bit by the end of May. And then as you're seeing this now, as our state has started to phase into the opening up, and we've gone through the phase 1 through phase 3 opening, we are now starting to see at the end of June or in the middle of June, the number of cases increasing. One of the challenging aspects of coronavirus or the COVID-19 is when we do an action, the reaction of whether we see cases or not usually is delayed by a few weeks. It's about, because the incubation time for COVID-19 is approximately 14 days with a mean symptomatic showing of about 5 to 6 days. It takes a while before we'll see what would happen when we do something. So as we went through the phases of opening up, it took about 2 weeks before we started seeing the first signs of whether or not the number of cases are increasing. And now that we've gone through all the phases, we've now seen that our trend, which was decreasing at first, is now looking to slowly start to uptick a little bit too. On the right side, that shows cumulative cases over time and the number of deaths. So the number of deaths has just increased incrementally versus the number of cases have increased exponentially. So that kind of shows that the death rate for the most part is staying the same. And our death rate nationally is about 5.5% That's the fatality rate. Now that's looking at total amount of deaths divided by the total number of cases that we know are positive. It's about 5.5%, and that is about the same as it is worldwide, fatality-wise. Next slide, please. So this is looking at now just COVID-19 areas, and so specifically specific hot spots within Tarrant County. If you look on the table on the right, it is showing the total number of cases per city. Fort Worth is number one with the most amount of cases at 3,800, and then followed by Arlington, and then subsequently it gets less and less. But Fort Worth and Arlington have the most amount of cases. I mean, there's a variety of reasons why that may be happening. One, we do have a lot of testing centers in Fort Worth. That's some of it. But then we also have a lot high density of people here in Fort Worth and Arlington. And a lot of long-term care facilities like nursing homes, and we have congregate settings like jails and prisons. So that's part of the reason why our numbers are higher. Next slide, please. So this graphic is showing our kind of more statistics and cases by age and gender. So if you look at the top left, we'll briefly talk about the hospitalization status. For everyone who's been tested positive here in Tarrant County, 23% of that group has been hospitalized at once. Now, hospitalizations will be at least 24 hours in the hospital. So a short ER visit is not counting as a hospitalization. That's just an ER visit and sent home. For those who are 65 and up, though, you could see 32% of that population who tested positive were hospitalized. And then 77% of people who test positive were not hospitalized. That includes all ages. You look at the types of transmission, which is also interesting. 46% of community transmission is from a known source, where they know they were in contact with someone who had the virus or symptoms of the virus, versus 24% have an unknown source. Undetermined means we just couldn't tell if they got it from the community or if it just popped up. We don't know. So let's look at age groups. Again, our age groups of cases are almost exactly like the national trends and state trends, where the majority of people who are getting the disease are anywhere from the age of 25 to 44. By gender, it's slightly more men than females, and we have seen that also again in national and worldwide data. Men tend to get more COVID-19 than females. We are unclear of why that is happening. And if you look at cases by race and ethnicity, the most is Hispanic, followed by Caucasian, and then African American. And then 23% didn't report their ethnicity, or we could not get their race or ethnicity. Next slide, please. So this is going to be talking about our deaths. So this statistic, or this slide group, looks at our death rate. So by age group, by and far, as we see nationally, if you're 65 and up, the death rate, the percent of deaths is the highest, so 57%. So out of all the cases we've had, of all the fatalities that we've had here in Tarrant County, 57% of them are above the age of 65. Why is that true? There's still studies looking into why 65, but in general, as we get older, our immune systems are not as robust as they are when one is younger. Also, as we get older, we tend to have more comorbidities. In other words, we have other diseases and other diseases that may contribute to worsening ability to fight the disease, like hypertension, diabetes, hyperlipidemia, cardiovascular diseases, things like that tend to make a person more susceptible to dying from COVID-19. So that's a large reason why we are, especially what we are doing in Tarrant County, we're really trying to visit and discuss with our long-term care facilities, because they're one of our most vulnerable populations, is our long-term care nursing homes. Between our Dr. Colquitt, who's our health authority, and I, we visited a vast majority of these long-term care facilities to try to get them, to help them in any way possible, whether it's making sure everyone's masked and using proper PPE, or just even simple things of seeing that, making sure people are washing their hands and doing their social distancing. So because they're a very vulnerable group. In terms of, again, deaths by gender, we see more males than females dying from this disease, again, following national trends. And then if you look at the deaths by date of death, we had a peak in May. Now that really long line is, we had a backlog, so we saw a lot of people die in one day in terms of when we counted. But for the most part, they kind of peaked in May, and then the trend has been kind of leveling off and staying steady. We hope that continues to stay the same. In terms of death by race and ethnicity, 46% are Caucasian versus 25% both Hispanic and African Americans. Next slide, please. So let's talk about, shift gears. Those are kind of our statistics for Tarrant County. Again, very similar to national and state trends just because of the diversity of our county. If we look at COVID-19 immunization, so as a result of our lockdown, our primary care doctors' offices weren't open. For instance, our Tarrant County Public Health immunization clinics, we had to close down temporarily during the lockdown. Well, as a result of not having care, we are seeing a decrease in vaccination rates for our children. So next slide, please. So it's going to be very important, especially as we talk about schools opening up this fall. We have got to catch up with vaccinating our kids. In Tarrant County, we estimate we are down about 300 children in terms of vaccinating for normal, our normal yearly vaccination kids here in Tarrant County, because we're normally, this is kind of the start of what we call shot rush. Shot rush is for us the giant vaccination right before school in August, and we start gearing up and people starting to come to our clinics to get their kids needed now. Well, because our immunization clinics haven't been open because of COVID-19, we've seen this giant drop. And this is the same nationally as well. We're seeing the same thing. So if you look at the percent of, if this table here is looking at sampling changes for age group, so from 0 to 24 months, it starts March, April, and May, you're seeing a decrease in the percent of change of vaccination, with the largest percent change of vaccination being from the 19 to 49-year-old age group, again, because the doctor's offices, the primary care offices who normally vaccinate this age group are not open. But you see anywhere, even from the young, from birth to 18, we're seeing these decreases in vaccination drops. So it's going to be very important that we encourage vaccinations. We're working on a plan now to develop a mobile clinic and mobile clinics so we can go to different areas in Tarrant County to start our vaccination. So we are getting trailers and mobile health clinics so we can vaccinate our kids and get them ready for school this fall. So that's all I have. Thank you very much. I'll entertain any questions you may have.
Dr. Murthy, thank you so much for that deep dive into the Tarrant County numbers, but also that reminder of how immunizations for other childhood illnesses are being affected by this. So that's really important. Could you just let us know what the best way on the Tarrant County Health website to access this information?
Yeah, so there's a lot of good stuff on our Tarrant County website. Again, it's www.tarrantcounty.com. As soon as you open that page, you will see a COVID-19 link. It'll be right in front of your face with a red bar. Click on that, and that will get you to our statistics. Another important, once you're there on our dashboard, you'll also see another link for testing. Now, currently, Tarrant County has, I believe, 5 drive-through testing sites in Tarrant County at various locations that one can get tested if they're either symptomatic for COVID-19 or came in contact with someone who had COVID-19. So there's a questionnaire form. You just fill it up. It's on the honor system. You fill it out, and then it will schedule you a test. So I encourage anyone who's listening, if you need to get tested, you have symptoms of COVID-19, please go on that website, look at our statistics, and then sign up for testing at our sites.
Thank you, Dr. Murthy, so much. And thank you to the team at Tarrant County Public Health. Our district is daily contact with your team. So thank you for being a great source of information and resources for us tonight.
Thank you, sir.
So one of the big questions that's coming up a lot in our Q&A and from our Facebook comments has to do with masks and face coverings. Here to talk about preventing the spread of COVID-19 is John Sims from Safer Care, Texas, and face masks are one of the topics he's going to discuss tonight. Mr. Sims?
Thank you, Mr. Kirshner, for that introduction and for you inviting me to this panelist. And thank you to all of you all for being interested in getting this education and information about reopening schools safely. I with Safer Care Texas and the University of North Texas Health Science Center, I was part of a team that opened 2 COVID testing sites in Tarrant County. And so I have seen the fears on people's minds when they think they may have COVID. But let's jump in here. Next slide, or first slide, and let's talk about masks. Now, all the panelists have discussed wearing a mask and social distancing and hand washing, and those are 3 constants, right? There's been a lot of information going around. If you watch the news, some of it may be conflicting, but these 3 things have remained constant. When I talk to my family members who do not have any healthcare experience, they don't work in healthcare, they tell me I don't need to wear a mask because I'm not worried about COVID. I'm not going to catch it. I feel just fine. And I have to educate them because, first of all, let's start with COVID-19, as Dr. Cervantes pointed out, is spread via droplets. Now, how do we spread droplets? We spread droplets via coughing, sneezing, and even when we talk. So infected droplets can transmit into another individual, and one of those individuals could be one of those vulnerable populations that the panelists have been talking about. So the mask is not to protect you who's wearing the mask. The mask rather is to prevent those droplets from being expelled out into the community and potentially spreading COVID. Now, some people think, again, I don't have COVID, I'm not worried about it. Well, there are asymptomatic people walking around that may have COVID, and they very well may not seek any medical attention. And so I think I know that it's extremely important for the community to wear masks to prevent the spread. A mask can be anything. I mean, there's a graphic here, but it can be any cloth mask, anything that covers the mouth or nose. It's another thing I want to point out. Of the people in the communities that I see that are wearing masks, and it's not everybody, they'll wear the mask and it just covers. They'll pull it over their mouth, and then their nose is exposed, and that's not going to cover it. You don't need to wear a mask if you're by yourself, if you're driving, if you're in an office by yourself. But when you are going to be around people, especially where social distancing is a challenge, it is extremely important to wear a mask. The CDC recommends for the community not to purchase surgical masks. As you may have heard, PPE is very limited, and so we want to reserve those for frontline healthcare workers who are actually providing care to COVID patients. Next slide, please. So, again, social distancing. Y'all have heard about the 6 feet distance. The other thing is 2 arm lengths. Y'all can't see me because I'm in a credit card like picture here, but just 2 arm lengths is usually about 6 feet. You don't want to have any gatherings of more than 10 people. And you do want to maintain social distancing during those encounters. If you can look at the graphic here, without social distancing, you've got one positive case. After 1 week, you'll have 3. And after 6 weeks, you can have as many as 1,093. And that just speaks to how fast this disease spreads. With social distancing, which is 33% fewer contacts, 1 case might turn to 2 cases in 1 week, but and 127 over 6 weeks. So it absolutely does make a difference. I know that social distancing is a challenge. I'm sure it's going to be a big challenge for school-age children, especially returning after all this time not being able to play with their friends. They're going to want to hug each other. They're going to want to play. I would recommend creating some games that incorporate social distancing. I don't know what those games are, but I'm sure some of the brilliant minds on this panel are teachers can create some very creative things for the kids to participate in. Next slide, please. So this is not a new concept at all. In fact, all healthcare professionals are drilled this concept from the day they enter whatever profession in healthcare that they're pursuing. And the reason is because we know that hand washing is the single best way to prevent infection, right? I can say that when I have provided direct patient care, I do wash my hands before and after each patient contact. I will say that I am probably more lax than we really should be, and I think a lot of us are. So the proper way to wash your hands, it takes about 20 seconds, and some literature suggests that you sing the happy birthday song twice while you wash your hands. But in this graphic, you can see that this person has already wet their hands and they've lathered up real good. So you want to get some good soap lather on your hands, and then you want to rub every surface in between your fingers, on the backs of your hands, with your palms, and then you even want to take your thumb and scrub it. And again, that takes about 20 seconds. So afterwards, you want to thoroughly rinse your hands, and then you want to thoroughly dry your hands. We need to wash our hands more often. As you can see, washing our hands before and after eating, after toileting, preparing food, taking out the trash, touching an animal, anything like that, we need to be washing our hands. And that's a whole lot more frequently than we're accustomed to. If soap and water is not available, you can use hand sanitizer. Just make sure that it's at least 60% alcohol based. And the last point I wanted to make here is during this presentation, I have counted myself touching my face 5 times. We are so, that's just a natural reaction. If your nose itches or your mouth itches, your eye itches, you're going to scratch it, right? You're going to rub your face. Really important not to do that without having washed your hands. So I hope this is useful to you. Again, I know this is not new information, but I think it's extremely important to spread this message to other people in the communities, your family members, your children, so that we can continue to prevent the spread of COVID-19. Absolutely,
Mr. Simpson. That's one of the objectives of tonight, is getting the information out there. And some of this information some of us know, but obviously when you look out there, like you said, not everyone's wearing face coverings. Proper hand washing isn't going on. And so part of our strategy is getting this information out there to everyone in our community. So thank you for providing those resources and those tips for preventing the spread of COVID-19.
My pleasure.
Thank you, sir. Well, our final expert panelist tonight is from Asthma 411, and Crowley IC's had a close partnership with Asthma 411 for many years. and Dr. Leslie Alsop is here. Dr. Alsop, we've received several questions tonight from different attendees who are parents of children with asthma and are very concerned about how their child may be affected by COVID-19. What information can you share with them?
Well, a lot of what I have prepared tonight is to bring some resources that we hope will be helpful to people. I want to say, first of all, how delighted I've been to be able to work with Crowley ISD and your wonderful health staff. And Misty Van Kampen is just a fantastic resource for the community's health. And we appreciate all she does and all that Crowley ISD does. I am also at Safer Care Texas at UNT Health Science Center. Asthma 411 is provided by a consortium of partners that you can see here on the slide. We have worked to put together an Asthma 411 website with a team at Safer Care this year that has a lot of resources available for asthma in particular. And we also anticipated that the community impacted by asthma would have a lot of specific questions about how COVID-19 might have consequences for them. So very early on, we put together a resource page. If you go to our website, it's there, very easy to see, and just wait a couple minutes and you'll see this set of COVID-19 resources that are really focused on the needs of those impacted by asthma. There's a video interview. We have some information about cleaning supplies, CDC links, and a number of other things so that if folks have asthma, they can go to the site, and we do work to keep this updated. So next slide, please. With the resources in our slide, I'd say this chart is one of the things we've gotten the most feedback that people have found is helpful to them. I think that one of the great challenges about COVID-19, of course, we know some people do not have any symptoms, but the symptoms, especially of mild disease, can end up mimicking so many other common conditions. And this chart has been put together by the Asthma and Allergy Federation of America. They are also linked to our website, and we keep updates from them as well. And it just gives an idea about how the symptoms of some of these various conditions, whether it's COVID-19, your more common cold, influenza infection, or other seasonal allergies, may be similar or different. Again, this is not going to provide something definitive, of course, of whether someone has COVID-19 or not, but I think a lot of people have found this useful and reassuring. Next slide, please. So what is some of the content that is especially for those important for those with asthma? And this is drawn from CDC recommendations. They continue to classify those with moderate to severe asthma as being at risk. We know in general, as you've heard many times tonight, that various comorbidities or other chronic illnesses can make someone's risk for severe COVID-19 outcomes increase. So because asthma is so often triggered by a viral infection of the upper respiratory tract under any circumstances, clearly out of precaution, before a whole lot of research evidence is actually available, CDC does want people with moderate to severe asthma to be considered at higher risk. Some good news is that with the research that is being available today, it's actually we're not seeing that asthma is showing up as one of those comorbidities that is especially associated with severe outcomes. Others, the cardiovascular risk that was mentioned, even diabetes, especially poorly controlled conditions. But asthma hasn't been showing up yet. We say that with, again, some caution, because all of the research evidence that's available now is still very early in the process. Most important, try to get that asthma under control and follow. If you don't have an asthma action plan, you don't have a medical home or a consistent care provider, this is really even more important than ever to make sure that asthma symptoms are under good control, and take those precautions. Stay in contact with your healthcare provider. One of the questions that's often been asked is whether people's medications for asthma might be themselves some type of a risk. Should they continue taking it or not? And the answer is definitely yes. The recommendations are very clear that continue your regular medications, especially if you're taking the daily controller medications, oral, inhaled corticosteroids. It helps with the control of asthma, and it's critical. Making sure you have an adequate supply of medication. We know that people may be quarantined. We want to make sure that supplies are available when you need it. So it is a great idea to assure you have at least a 30-day supply of your medications. We know that strong emotions are sometimes triggers for asthma attacks, and boy, oh boy, a pandemic can be a trigger for stress and anxiety. We all know that, and we've all experienced it. So taking those steps to be aware, whether it's yourself or your child who may be affected by asthma, take those steps to help manage stress and cope with stress. The CDC, the links that we have on our website have some very specific information and recommendations about controlling stress, including for those with asthma. It also has some good resources for talking to children about COVID-19 and how to explain these concerns in a language that is understandable to younger children. Avoid the asthma triggers, always important, but now more so than ever. Kind of an interesting note as we look for some positive things in these difficult times. Early studies are actually showing that emergency department visits for asthma for children have really dropped. And there's also an indication, hospitalizations haven't gone up. It really seems that it's more than folks just wanting to wait and not head to the emergency department. Possibly this is because that when people are doing the sheltering at home or avoiding the social distancing, they're not getting as many other viruses. All these measures that we've talked about so far to avoid the spread are going to help reduce the other common respiratory infections that so often will trigger asthma symptoms. Everybody's concerned about disinfecting and cleaning. It's important to be aware that some disinfectants can really be an asthma trigger. And bleach in particular is something that is can be a trigger for many people who suffer from asthma. There are alternatives out there. If someone is using any kind of disinfectant, try to use good ventilation. And if it's possible to protect the person who is impacted by asthma from that disinfection process, that's a great idea. A point to make, and we are working closely with all our partner school districts on this, the use of nebulizers themselves, if somebody has COVID-19, might be a risk for spreading the virus. So what we're working to do is to try and transition as much as possible away from using the nebulizers and toward using the meter dose inhalers with a holding chamber. There's disposable holding chambers. This is something that we're working very, very hard toward. Meter dose inhalers, sometimes people call them puffers. In any event, if that's an option, it's a great one, because the nebulizers themselves may pose an exposure risk. And we'd recommend, if it's possible to get your child, if they use a nebulizer, better to use a meter dose inhaler if that's possible. Last, and I'll wrap it up, that is, please make sure that if your child has a history of asthma, that you have that report as part of your school health history, and it's documented so that your nursing staff and your health staff are aware of that and will be able to provide the appropriate support for your children. Have that asthma action plan and have their medication authorization from their physician at school. Thanks so much.
Dr. Alsop, thank you. I know with as many families in our community that have children with asthma, this is important information. We thank you for all that you do for our school district on our campuses, you and your team there at Asthma 411. So thank you, Dr. Alsop, and all of our panelists this evening, providing a wealth of information. Our goal was for our community to hear from those experts that we're working with daily, so that we're all hearing the same message. Dr. McFarland, a lot of great comments and questions and concerns coming in through our Q&A box here in Zoom and on Facebook. And one of those reoccurring questions has to do with, okay, so now we know this information, what's Crowley ISD's plan, particularly would distance learning be an option going forward?
Yeah, no doubt, Mr. Kirshner, and that's one of the things that I'd like to kind of talk a little bit more about, a little more in detail about as we define the plan more. What we do know is that we are preparing right now for two options. For one is a face-to-face option, and the second option will be a fully online virtual option. We are again continuing to get guidance from TEA, from the Texas Education Agency, but we want you to know that we are definitely planning along those veins of being able to have both an online option as well as a face-to-face option if that's provided, for sure.
Great, and that was we have a survey out for our community right now about potential options, and we've had more than 5,000 people participate in that survey. There's one for elementary and secondary, and distance learning is something that there is definitely an interest for and a desire to learn more about. So,
no doubt. And also, Mr. Kirshner, what I like to do, because it's not often that you get a chance to work in a school district and in a community where you have all the board members who have either currently or in the past had students in our district. And so I'm very proud of the fact that all 7 of our board members have either had students in our district in the past or they currently have students in our district right now. And they are all on the call tonight because the message has been really clear from them. We want to make sure that we do whatever it takes in order to ensure the safety of our students. And so I want to just publicly thank Ms. Mayfield, Ms. Robinson, Ms. Davis, Mr. Gracia, Ms. Bennett, and also Ms. Benton, also Mr. Ray. And then we also have our board president, Ms. Hall. And I know Mr. Hall is a current parent, and so I'd like Mr. Hall to just share some comments, and then we'll go back to answering questions. But I would like to acknowledge our board members because we're here tonight because they have insisted that we listen to the community. So Ms. Hall, would you like to just share us some greetings?
Sure. Good evening to everyone. My name is Mia Hall. I am your Crowley ISD School Board President. And I would like first to bring greetings and on behalf of the entire board, and also to thank all of our panelists, our community that are participating, as well as our Crowley ISD work family that are also participating tonight in this discussion. I guess my position and role in the district allowed me the opportunity to talk to you tonight, but it also allows me the opportunity to serve on the Project 813 awareness pilot planning team. And so we have been meeting weekly for quite some time, sharing ideas. Dr. Crystal Taylor probably set the groundwork for those discussions, and we have been meeting very diligently and very intently, bringing a lot of information. So as an educator, I can appreciate all the work that's being put forth by our Crowley ISD work family. A tremendous amount of time is being given and consideration for every aspect. Every meeting brings a new thought. We're constantly sharing articles and things like that with one another, text messages, Facebook, everything, just trying to make sure that we have all the facts. So having our panelists here in one sitting has been really great, and I can only imagine what our next meeting will be like. So thank you for all of the information that you brought forward. And then also as a parent, my son is now, after I guess we've had our last graduation last night, my son is now going to be a senior. He'll be class of 2021. And I think every day our conversations are about, is baseball going to happen and is prom going to happen? And so I know that all of those things are just culminating activities out of the school year. And so in order for those things to happen for him and for all of our students to have the activities and the rituals that they have been looking forward to depends on the success of our school year. So thank everyone on the panel. Thank everyone that's working so hard to make sure that we have a successful opening and a successful start. And thank you for all of this. It was great information, and I suffer with a little ADD, and you didn't lose my focus or attention at all. So thank you. I feel better for it, and I know that we're in good hands.
All right.
With that, I'm going to give it back to Dr. McFarland. I can't wait to hear the question and answer session.
All right. Well, again, thank you, Ms. Hall, and thank you to all the board members for being present. Mr. Kirshner, I think we're prepared to answer a few of the questions, the ones that we can, and then the ones that we can't answer. What we're committed to is coming back at a later town hall and providing answers. But we will answer the ones we can tonight.
Yeah, Dr. McFarland, a hot topic tonight. Many of our presenters touched on it, and a lot of questions are asked about mask and face coverings. Is that something that we're considering requiring for our students and staff? And if so, how would that work?
So yes, we have clearly heard from all officials, both on the call tonight and also just in the media. We constantly hear about the importance of wearing masks. And so wearing masks will be a part of the requirement when we return. Now, the specifics of what it'll look like and how we will manage it, what we'll provide, those things we're still working through. We know TEA is looking at funding and providing some funding for us to be able to provide masks to employees. However, we do know that the mask will likely become a part of the uniform. So just as students are wearing shirts and belts and other things, then we know that masks will just become a part of the uniform for a while. Again, we're working through that. The final decisions have not been made, but right now we are looking at requiring students to wear a mask as well as adults to wear a mask as well.
Thank you, sir. Also, some questions coming in about how does social distancing work in classrooms if you're having to limit the number of students in there, not only in classrooms, but also a lot of questions about school buses. So we talk about the guidelines that are being given for social distancing in classrooms and school buses.
So really, that's where the ambiguity comes. It's quite frankly, the one of the reasons we're having the conversation today is we're trying to get from parents what are the most critical decisions. We know that when we hear social distancing and we think about a classroom, the question is, do we have enough classroom space to be able to separate students, to spread students 6 feet apart? And so that's important for us to evaluate. We're in the process of evaluating that right now, but we don't know exactly what that will look like, but we do know that we'll get direction from TEA within the next week or the next week and a half. We'll get information. We'll be able to answer exactly those questions, like what will it look like on a bus? What will it look like in a classroom? Will there be capacity requirements? We know that right now, I think we're at 75% capacity across the state right now. And the question is, will we be at 100%? And if we're at 100% capacity, then will that impact social distancing requirements? A lot of those things will be driven by the governor's mandate. And so we're kind of waiting and seeing there. And so we know that it'll look different. We're not sure right now what it is, and we don't believe anybody knows. What I do know is we have a team of people that's working to try to figure out alternatives if we have to social distance.
Absolutely. We've had some questions about the possibility of COVID-19 testing for students and staff, and would that be available and or possibly required before anyone could return?
You know, we really like to leave the requirements to testing to our health professionals, and I think we've heard earlier is, you know, when there's a cause or a reason to do that, we feel like that's important. But we would defer those kind of decisions as relates to requiring testing to our health professionals. And if they told us that that was necessary, then we would figure out how we would do that. We do know that right now there are drive-through testing that's available for people who have previous symptoms or possible exposure. But as far as us requiring testing right now, we're not prepared to do that at this point.
Oh, can I speak to that just a little bit?
Sure.
I do know that Tarrant County is still continuing testing, and there are drive-through testing sites still going on. HSC just kind of moved out of that because we spent about 3 months on that adventure. And our scope, while it started with our first responders and healthcare professionals, then it evolved to people with symptoms. For the last 2 or 3 weeks, it has the scope has been wide open to people without symptoms. And so I'll leave that to y'all if y'all think that that's important before you bring everybody, you know, back to work. But I do know that testing is available for asymptomatic people.
Okay. That's definitely great information, and that's you know, that's one of the purposes for forums like this, is for us to find information out firsthand. So that's good information, and we'll follow up with that.
Absolutely. We had a question, from parents of our special needs students. We know that they are at higher risk, and also masks can be a challenge sometimes, in social distancing. And so you want to talk about our incredible special education department and Ms. Batiste and our educators there who are working alongside us.
Yeah, that's definitely a challenging one, and there are no easy answers today as it relates to how we special distance in those environments. I could definitely see us having some kind of testing requirement in those environments where we know that wearing a mask may just not be something that's allowable or even feasible. I can see us making a case to be able to test people in those situations, and really putting some different guidelines in for students with special needs than what we may have for other students. But again, that is an area that we're having some concern about and conversation about. What we know is that there are special students receiving special services all over the state. This is a hot topic, a top issue for many of us, and so we're working around it. Right now, the issue is that we know, you know, face coverings may not be feasible. So now, how do we protect both the student as well as the adult? And we're working through possibilities of that. We think testing of people in that environment for sure would be something that we would do. And then, of course, we're definitely increasing cleaning across the board. And so in those spaces, we definitely would look at how we even clean even more regularly.
Dr. McFarland, as a parent yourself, what message would you have for parents who are concerned and worried and afraid of the possibility of sending their child to school in the fall?
Well, I think the first question, the first comment I would have is, as a parent, I understand. You should be wary. We all should be wary. When we see that people are continuing to contract the disease, and there are still people that are dying, we need to be worried about that. But we also need to understand that we have some very clear ways of mitigating possible spread. And I think we have to do that too. Our part is, you know, in this situation, really as a parent, you really have to control the part that we can control, and making sure that we have proper hand washing, that our kids are wearing face masks, that we're practicing social distancing. Now, on the flip side, we also, as parents, we also expect that the leaders, the superintendent, the board members, the people in the school district, that we're taking precaution. And so what I hope, parents, that you understand and you see is that we're not just relying on information that we're receiving from the news media. We're going firsthand. We have firsthand educators in China that we're talking directly with. We're talking with health officials at the state level, also at the local level in our county. And so we are doing our due diligence to make sure that we have the information, that we understand the science, that we're following the data, and that we can make good decisions for our children. You know, one of the things is, I know the challenge is, people want to know, like, what's the plan today? Well, if we felt like the information that we have today is stable information and reliable information, then we could actually make a plan for today. But the good thing is, it's June the 16th, and we start school on August the 13th. And we know that there will be there's a lot of information, a lot of variables that will occur between June 16th and, for us, really July 16th. Because by mid-July, we will have a clear plan for online learning. We'll have a clear plan for face-to-face learning. We'll have a clear plan for re-entry. We'll be able to talk about what the transportation will look like and how we will social distance on the bus if we have to do that. We'll be able to talk about what recess will look like. We'll be able to talk about what lunch will look like. All those questions that you have as a parent, I have as well. We want to know, how do we do this? And so what I'm telling you is that we are not making these decisions on how to do it in isolation. We're depending on you. So your questions will help us. We also have teams of about 150 educators in the district, from teachers to principals to central office folks to board members. And we have about 10 different teams that are working on different components of the plan. And so collaboration is key. But to be honest with you, today, you should be concerned, because we are. And we are taking necessary precautions to make sure that by August 13th, by 8/13, that we'll be ready to go back to school. That's our hope, and that will be our plan.
Thank you, sir, for that encouragement and that information from you and all of our panelists, and especially our attendees tonight who've taken time out of their evenings to be with us. We've had more than 500 different people joining us on this town hall on Facebook and on Zoom. We've captured all of your questions. We may not have been able to answer all of your questions tonight, but we've captured all of those. And we know there's going to be more questions, so please keep those questions coming. We will have future events. We'll have opportunities to hear from these experts again and other experts that we're working with. And we can't do this without you. Going back to our Vision 2025 strategic plan that Dr. McFarland started with, our engaged community is crucial as we go through this together. And our theme when we started the school year was Crowley Pride Unified. And Dr. McFarland, to see our community coming together like this with this unity, wanting the best for our students and staff and families, it's more appropriate than ever. So thank you everyone for this pride in your district and for the unity that we have here in Crowley ISD.
No doubt. Thank you very much.
Thank you all. Have a wonderful evening. Thank you for taking time to be with us. Panelists, again, thank you for your expertise.
Thank you.
We appreciate you all so much. Everyone have a great evening.
Thanks, everyone. Bye-bye.